one of the things that has to do with the project is that we know that for them not to get immunization, there may be a reason for it. So in trying to look for solutions, we must know what are the things causing those things. When we're able to solve the root causes, then we can have sustainable solution. So one has this mother or this woman who has a child that is 2 years old, and the last time the child got immunization was when the child was 6 months old. So Madam Shelley saw it.
The reason is that eponimo wa tẹ́lẹ̀, so mo ṣe padà sí Abẹ́òkúta, so gbogbo ìgbà yẹn mo ti bí mo dẹ̀ ti ń gbà lọ ní ẹ̀kọ́, so mo kọ̀ ní small issue ní Abẹ́òkúta, so mi ò rí health center kankan tí mo ti gba abẹ́rẹ́ reason kan tí ò ṣe jẹ́ kí n.
Okay, so basically what this woman has said is that her child is 2 years old. She was initially living in Lagos, but she had to relocate to Abeokuta, that's Ogun State here. And then when she got in here, she didn't have any health center that is kind of close to her. So because of that, she just couldn't go anywhere to continue getting the immunization. So this still boils down to relatively low accessibility to healthcare and maybe some low proximity. In terms of proximity to the nearest health center, she felt she doesn't have one that is so close to her, and she stopped collecting immunization. So at this point, I want Joy to give her input as touching this woman. Thank you.
Yeah, so part of my project working with WAF this summer is focusing on maternal and child health, specifically how to implement policy and make sustainable practices that allow mothers to have safe children and allow the mothers themselves to be safe. So as you mentioned, there's not access to and making sure that the mothers are safe postnatal and continue through their child's life. So as this mother mentioned, something that prevented her from getting her child fully vaccinated was access to medical facilities. And what we're talking about here in terms of bridging the gap with immunizations to ensure safe motherhood is making sure that they have access. It's not a matter of people don't know what to do, it's just that they're not able to do what they know they're supposed to do. It's either time, transportation, again, access to facilities, where the facilities are located, increasing the number of those so that more people are able to access these immunizations that keep both mothers and children healthy. Specifically for mothers, like prevention of certain diseases can begin in utero. So talking about the tetanus vaccine, which is TT1 through TT5, that can begin in utero for the mother so that the children are protected against tetanus later in their life. And all of these do again come with increasing access to these immunizations at medical facilities and really making sure that mothers are aware that they do now have access to more resources such as these.
For this outreach, we are from Wellness After Foundation, and we are here at Lakiri Community. And then what we are here for is for Know Your Status outreach. But we have been able to see something very important, and that thing is the fact that there are different children that are here because of relatively low accessibility to healthcare. They have not been fully immunized for age. So we have different children here that are, like some 2-year-old child that had the last immunization at 10 weeks old. Like we know that any child born should have immunization at different stages: at birth, at 6 weeks, at 10 weeks, at 14 weeks, at 6 months, at 9 months, at 10, that's 1 year, that's 12 months, then 15 months, which is a year and 3 months. But all those age groups have different immunization that they should get. And these are things we call vaccine preventable diseases. So this is very important because one of the things we are planning is that we're still going to come here to have like an immunization outreach, which would also, this is our immunization outreach officer for this community in person of Mrs. Taiwo. She's going to come here to see the different children, and this is particularly important because we also have our interns that are currently working on maternal and child health in person of Oge Obogo and Joni Ojumo. They're also going to be working on maternal and child health. So Oge is going to be working on immunization and how to help, to increase immunization coverage, especially to hard-to-reach communities like we have currently. So let me just bring us back to the children, for example. Mama, ọmọdún mélòó lọmọ yín? Ọmọ oṣù mélòó? Oṣù méjì. Gbà ó lẹ́gbàá abẹ́rẹ́ àjẹsára fún gbẹ̀yìn.
ọ̀sẹ̀ tó kọjá.
Just okay, so
Gbogbo ẹ̀ ló wá fún pàtó.
okay, so this is an example of a child who is about 2 months old thereabout and has only been to the facility to get immunization that should be given at birth. So the child is not fully immunized for age. She needs to do this. So basically, the reason we are here. So at this point, I'm going to bring in Oge. She's going to talk to us about the reason, the whole idea of the project on immunization coverage. So just talk to us about what you intend to do for immunization.
My role in JAR for the Child Immunization Project is to assess what are the common missing vaccines, so to be able to fully determine what vaccines are missing, but also what's the main cause of the problem. So is it being able to get to the healthcare clinic? Is it knowing that you need to come back to the clinic? Is it that we can't store the immunizations properly because they have different storage? So there's a lot of different things that could be the problem as to why these immunizations are missing. But so part of my project is to determine what are those problems, but then also like what methods can we do to be able to help fix those gaps. So is that being able to come more frequently so that nurses can come and give immunization? Is it to find local clinics and tell people this is your local clinic so people know where to go? Or is it being able to inform people how the vaccines work, what the vaccines are preventing, what is vitamin A, what is meningitis, etc., and doing immunization education to be able to help inform people to know why it's important to be on top of these things. And then hopefully by the end of this, we'll be able to at least begin the creation of a plan that WAF can continue on doing so that we can have the proper immunization care for the rural communities in need. Because as what Omatola was saying, it's when you have vaccine preventable diseases, even one intervention is enough to prevent disease from happening in the future, and those forms of early intervention could prevent long-term care from happening in the future. So that's what my project is going to be on.
Okay, so thank you very much.
Next month, láti wá fún gbogbo ọmọ tí wọ́n ti due fún immunization abẹ́rẹ́ àjẹsára, àwọn tí wọ́n ti gbà àtàwọn tí wọ́n ti gbà, a máa yẹ káàdì wọn wò, àdìmọ́ bá wọn ya wọn sọ lórí bí wọ́n ṣe lè máa lo káàdì, torí nínú káàdì ọ̀pọ̀lọpọ̀ ìwúlò ló wà ń bẹ. Tọ́mọ wọn bá yàgbẹ́ gbu nǹkan tí wọ́n lè ṣe láti lè tọ́jú àwọn ọmọ yẹn ó wà nínú káàdì yẹn. Tí ọmọ tó bá ń dàgbà dáadáa, bá a ṣe lè mọ́ wà nínú káàdì yẹn náà, ayé ẹ̀ ti wà ń bẹ. So wọ́n máa kọ́ wọn bá ṣe máa lo káàdì àti láti fún ọmọ yẹn ní abẹ́rẹ́ àjẹsára nígbà tó tọ́ àti ìgbà tó yẹ. Ẹ ṣé.
Kí ni olóyè Fáyẹmí Toríọlá Àkànní income cabinet orílẹ̀ Togo lẹ́ẹ̀kan sí mo dúpẹ́ lọ́wọ́ àwọn Witness Africa Foundation, mo dúpẹ́ lọ́wọ́ Ọlọ́run gidi gan, Ọlọ́run á máa ràn wọ́n torí ṣé ìgbà tó ń dé lé ní iṣẹ́ gidi gan lọ́ ṣe wọ́n jẹ́ ká mọ nǹkan tó ń ṣẹlẹ̀ torí ibi táwa ìgbèríko gan ni Olúwa là wá lóye. A rí mọ̀ yìí pé ọmọ mi wà olómi wà ìfúnpá ẹ̀ga, olómi wà ohun tó ń ṣe kòkòrò ni, olómi wà ibà ni, olómi wà bẹ́ẹ̀ bẹ́ẹ̀ lọ. So a dúpẹ́ lọ́wọ́ wọn. Irú ètò yìí Ọlọ́run máa ràn wọ́n lọ́wọ́. A lè ṣàdúrà fún pé òkè òkè ni ọmọ máa lọ. Wọ́n jọ ìtura Ọlọ́run kán ṣùgbọ́n wa kán ràn wá lọ́wọ́. A rẹ́dì láti support wọn, ká fọwọ́sowọ́pọ̀ pẹ̀lú wọn ẹni tàbí torí ètò bá wa tún fẹ́ ń bí torí ń tà rí lárí ládùúgbò ń bí. So a dúpẹ́ lọ́wọ́ wọn. Wọ́n á máa lọ sókè, wọ́n á máa lọ wọn á máa gbòòrò, iléeṣẹ́ wọn ò ní jóná, wọ́n á bá léèrè, á ní fi iléeṣẹ́ àṣemọ́. Mo dúpẹ́ gidigidi Ọlọ́run ní mo dẹ̀ ń gbẹ́nu bàbá wa Olúwo sọ̀rọ̀ torí wọ́n ti dàgbà, wọ́n wà nílé, wọn ló fi ṣe ìran mi pé wọ́n dúpẹ́ lọ́wọ́ wọn, á máa lọ síwájú ní agbára Ọlọ́run, lágbára Ọlọ́run, wọn ò ní tẹ́ wọn ní tí gbogbo tó bá dáwọ́ lé á máa yọrí sí rere. Òkè tó ń gùn wọ́n á sọ̀kalẹ̀ láyọ̀, ọmọ tí wọ́n náà kò sí nǹkan tó máa ṣe, kò sí nǹkan tó máa ṣe ọmọ gbogbo wa. Ẹ ṣé, a dúpẹ́ lọ́wọ́ yín. Orúkọ mi lẹ́ẹ̀kan sí ni olóyè Fáyẹmí Toríọlá income kábíyèsí orílẹ̀ Togo. A dúpẹ́ lọ́wọ́ yín. Thank you.
Thank you, Makato Foundation.
Thank you, Makato Foundation.
Thank you, Ford Foundation.
Thank you, Ford Foundation.
Thank you, Leap Africa.
Thank you, Leap Africa.
Thank you, Wellness Africa Foundation.
Thank you, Wellness Africa Foundation.
FMCCMPC.
Thank you, FMCCMPC.
Thank you, NYC SDGs.
Thank you, NYC SDGs.
And thank you,
Lakiri Community.
Audio Jungle.